Welcome to The Scope with Dr. K. I'm Dr. Kosinski. We're going to open the show as we always do by stating that the goal of this show is to present you with a broad scope of value-based care issues, mainly involving the field of gastroenterology, but also outside of GI as well. Today we have a unique show as we are recording it from the health conference being held in Las Vegas. Health, HLTH, is truly a fantastic networking event for anyone in healthcare technology. Now in its fifth year, this 4-day event convenes the entire healthcare ecosystem, from innovators to providers. In this way, it connects all of the components of healthcare to help us build relationships that truly move the needle. It breaks down the silos and unites all participants within one holistic environment and pushes the boundaries in the healthcare industry. This year, Health attracted 9,500 attendees, 800 sponsors, and 300 speakers. The leadership of Sonar was excited to attend this event. I attended along with our CEO, Beth Houck, and our Chief Product Officer, Ben Stormer. Our booth was positioned as a member of the Matter exhibit, which included 34 companies. Incubated by the city of Chicago and initially funded by the state of Illinois and some area businesses. Matter opened its doors in February of 2015 with 30 startup companies and a few programs. It has since grown to include hundreds of startup and growth stage companies from around the world. It has dozens of corporate partners and a diverse array of programs supporting healthcare entrepreneurship and innovation. Sonar had its original office at Matter back in 2016. It was at Matter that we obtained our original funding from the Blue Venture Fund and Arboretum Ventures through our participation in a Shark Tank held at Matter. Steven Collens, the founder of Matter, was on our original corporate board and has been instrumental in our development. I met with Steven at Health. Let's listen to this interview.
I'm here at Health, and I'm interviewing Steven Collens, who founded Matter, a company that was very instrumental in the formation of SonarMD. We actually had our early offices there. Steven is here with a group of companies that Matter has engaged with, and I'm going to try and pick his brain as to where he thinks things are going for these companies. Steven, nice to have you here.
Larry, thanks for having me. Always a pleasure.
Yeah. So we're standing here and you have probably 34 companies here.
Yes.
And they're all Matter companies, and I know we're one of them. And so what was your purpose for bringing these companies to Matter and to Health? What are you trying to accomplish?
I mean, there's a lot that you can accomplish with a Zoom call, and there's a lot that you really can't. And this is 10 or 12,000 people at this conference, a bunch of investors, health systems, insurance companies, and other startups. And so the opportunity to get visibility for all of these companies is huge. Could be for investment purposes, could be for customer acquisition, for market traction. It's an important conference for health innovators.
Well, I know it would have been very difficult for our small company to have a booth here, to finance the booth, to put it all together on our own. But being part of what you had put together certainly made it possible for us to have our own presence at Health. Many of your companies here are in the specialty space.
Yes.
Where do you see specialty value-based care going in the future? What are you hoping it to become?
I certainly hope that it is the future, because the closer we get to actual value-based care for specialty, or honestly for anything, the more opportunity there is for health innovators to take their technologies and take their solutions and get market traction from them. And I think one of the biggest impediments to health innovation is fee-for-service healthcare, because the economics of outcomes aren't aligned with the economics of activity all the time, and it's a real challenge. I know it's been a challenge for SonarMD, it's been a challenge for so many companies that have real solutions that can demonstrably improve health, that can reduce hospitalizations, that can improve outcomes, but the economics of the market aren't configured such in a fee-for-service economy, in a fee-for-service system, to really allow those solutions to flourish. So the closer my aspiration would be to get rid of fee-for-service healthcare, and the closer we get to real value-based care, the more these solutions are going to be able to thrive in the market.
Well, I think we all hope that fee-for-service becomes less desirable in the future, and that will leverage the value-based care to consume a larger component of the revenue for providers. Well, thank you, Stevens. Thank you for taking some time out of your day, and I wish luck to every one of your 32 companies, especially Sonar. 34.
Thank you, Dr. K.
Okay.
I have a lot of respect for Steven Collens and for what he has done at Matter. If you have a startup healthcare company or growth company and want the perfect incubation experience, you can't find a better place than Matter. A major segment of the attendees at Health come from companies involved in healthcare data analytics. One of these attendees who visited our booth was Dr. Mary Henderson, principal and co-founder of Health Analytics Connect. With more than 30 years experience designing and implementing business intelligence products in the healthcare reporting and analytics industry, Mary has conducted analysis of cost, utilization, and quality, and has participated in healthcare benefits and healthcare management programs for many top U.S. employers, leading health plans, and large provider organizations. Previously, she was the president of the CVS Aetna-owned subsidiary, Health Data Management Solutions. She then served as Senior Vice President of Business Solutions at the AMA. Mary's most recent position was with Blue Health Intelligence, BHI, a Blue Cross-owned company specializing in advanced data analytics and solutions that are empowered by the largest commercial claims database in the country. She served as Executive Vice President and oversaw all sales of products and services, account management, and product development. Let's listen to my interview with Mary.
I'm sitting here at Health with Mary Henderson, Dr. Mary Henderson, who is the principal and co-founder of Health Analytics Connect. And I'm going to ask her why she's here, what she hopes to get out of health. Sure. Hi, Mary. How you doing?
Hi, how are you doing?
I'm doing wonderful.
So
nice to meet you.
Larry.
Nice to meet you. So what brings you to Health? What are you trying to accomplish?
Well, as you guys well know, and I'm sure everybody in this room knows, that data is always the foundation of all of this great work that you innovators are doing and all the rest of it. So the thing that happens a lot with healthcare, right, is that people start drowning in their data. There's just so much that they can integrate. So what we try to do is figure out, how do you prioritize? What do you really need to bring together, standardize, put in your tools, put up in the cloud, slap a UI in front of it, whatever you need to do the analytics, do the AI work and all the rest of it. But you really have to be very thoughtful and planful about what is that use case, what is that end user, what are you getting out of it. So our name, Health Analytics Connect, is that we try to connect the business users and the end users with the data and the tools to get to the answer that you need. And I think that a lot of the activity around here, almost every presentation will end in, tell me about the data that you're pulling in. So that's really why I'm here.
So you're here looking for customers.
Yes,
clients.
Yes, customers. We have a couple people that we're working with already that are here, and that we're just touching base with them as well. So we can actually help with the actual coding, or we can actually help with the strategy, or we can actually again kind of help with the reporting. A lot of people don't really know how to do an impactful report out to like your investors or to your customers. So we've had a lot of experience doing that. So that's why we're here.
Well, Mary Henderson, good luck at the conference. I hope it's useful for you.
Well,
and I'm sure we will talk again.
I'm sure we will. Well, good luck to Sonar.
Thank you. Thank you.
If you have just tuned in, you are listening to The Scope with Dr. K. We are broadcasting from Health, the health conference in Las Vegas, and interviewing a few key opinion leaders from the meeting. Like Sonar, Health attracted many startup companies. This is their opportunity to network with potential investors as well as potential customers and suppliers. One of these startup companies is Limber Health. Like SonarMD, Limber Health is a blue venture portfolio company. They are creating value-based solutions for the MSK space, the large percentage of the population with musculoskeletal disorders. I had the opportunity to interview Dr. Marc Gruner, its chief medical officer and co-founder. Let's listen to that interview.
I'm here with Marc Gruner, who is the co-founder and chief medical officer of Limber Health. And he's here to suck up everything he can in health, and he's going to tell you about his company. Marc, nice to have you.
Nice to have you. I'm here to learn the best from you, Larry.
Yeah. You're doing just fine on your own. So tell us about Limber Health. What is Limber Health?
So Limber Health is an MSK solution. So we provide therapy, collect patient-reported outcomes, and we work with physical therapists and orthopedic providers, and we create innovative value-based care models that we can work with providers and payers.
So tell me, describe what you would consider a value-based care model for MSK.
So there's two different types of value-based care models that exist for MSK. One is a bundle. Someone gets a surgery and they get a 90-day episode. Or the second one is managing chronic diseases or the entire MSK spectrum. And for those, you know the best model that I think exists today is where you look at it over the course of a year. So we have a comprehensive MSK value-based care offering, and it starts at either the physician evaluation or the PT evaluation. It goes 1 year, and we collect pain and function measures at the beginning and pain and function measures at the end. And we have CPT codes that cover our care navigation services.
So you actually are a provider.
So we work with the provider. The provider builds these codes that cover our coaches that work with those providers.
I see, then they reimburse you. So your business model currently is that the provider is compensating you for your service.
That's correct. For the CPT code, for our value-based care contracts, we would go straight to the payer and a provider, and there's different situations to work with that.
Okay, so when you go to a payer, you're offering them a savings, or how does it work?
Yeah, so what we say is that, we have these codes that cover us. If you don't cover these codes, we talk about covering these codes. They're level 1 codes, and they just went reimbursed by Medicare January 1st. There's over 29 commercial payers that are covering these codes now. And then so we need these codes to provide the services that we think are helpful for being a tech enablement service and care navigation service. And then we do a 1-year total cost of shared savings on all of MSK care.
Okay, are you taking downside risk as well?
Depending on the situation, we will do.
I know. If we've seen one plan, we've seen one plan. Yeah, it differs from plan to plan. I get it. Okay. Well, you're doing with MSK a similar type of job as what we're doing with GI care at Sonar. Interesting. So, what did you hope to accomplish at Health? Why are you here?
Yeah. So I think one is just talking to several payers and hearing what they're looking for to implement for 2023 is really important. Are they thinking about population health models for specialty care, or how do they see specialty care models being working with some of the direct contracting entities that they're doing for primary care? And I just wanted to listen and learn and have some conversations and understand from a payer's perspective what they're looking to accomplish in value-based care for 2023.
I see. Well, you're another blue venture fund company like we are, and so we're both in this phase where we're trying to grow the company with a limited amount of funds that we have available to us. But it is interesting that CMS, CMMI, PTAC are focused on specialty-based, value-based care. So maybe we are hitting this at the right time.
I hope so. I've been working on this for 15 years. And I can say that it's hard, it's challenging, but I think what I hope is that a lot of specialists come together, have similar models that can be easily implemented so a payer doesn't get confused or stressed out with several different models, and have some type of synergies where they think they can implement it and be successful and live within the ecosystem of either a population health model or what they're doing with ACOs or what they're doing with different patient-centered medical home models with primary care.
From your lips, my friend, I hope it all comes to pass. We're going to have you on as a full podcast in the future. Thank you. Thank you very much. Bye-bye.
I could have spoken with Marc much further. We'll have him and his brother, who is the co-founder of Limber, on a full show later. The last person and most important person I want to include in this set from health is our CEO, Beth Houck. There are multiple reasons that drove Beth to bring her leadership team to health. Let's ask her that very question. Hey, Beth, why did you decide to bring our leadership team to health?
Well, Larry, besides the opportunity to learn craps from you, there were some business reasons for attending. So first off, the content was fantastic. So it's always wonderful when you're going to a conference, to have the opportunity to learn. That's an important part of doing our jobs, is continuing to learn. The second, it was an opportunity to look at what are the other companies out there doing that could be partners to us. One of the things I think that we are doing an incredible job with is managing patients in a longitudinal way and really learning about them along their chronic GI disease path. That creates an opportunity for us to elevate other services to them. And we want to know what's out there, and we want to know how those people are thinking about the craft that they're thinking about. So sleep as an example, or nutrition, or anything related to mental health. There's those people really, really know their craft. So we wanted to talk to people that are doing something complementary to what we're doing and learn how we might be able to integrate that into what we are delivering. And then, of course, lastly, there's a whole load of investors out there. And I like to think of it as we get the opportunity to tell the Sonar story to those investors so that we can position ourselves best so that we can grow our company and impact more lives. But I like to learn from the investors. So they see a lot of companies, they talk to a lot of people, and they have a lot of internal resources that are developing theses and strategic thinking related to what we do. So I want to learn from them as well. And so we have the opportunity to have lots of those conversations.
Well, Beth, I was totally blown away by the energy in the exhibit hall. I've been to a lot of meetings, but this one you could just, it's almost like you were standing next to a beehive. There was just so much energy that was going on. And, for the listeners, Matter was an example of one of many healthcare incubators that brought companies. So Matter had 34 of us in a circular arrangement around a center core, and there must have been another 10 of these around. So you could walk around these displays and talk to multiple companies. And we were approached by investors who we really had never even spoken to before that came up to the booth and started asking us about our company. So it was a wonderful, wonderful place for linking, networking with the various other components. Some of the companies were there looking for customers or looking for suppliers. And so it really was tremendous. Plus, you know what? We won at that craps table, didn't we?
We sure did. We sure did. I had an excellent teacher.
Yeah, right. I got lucky. Sometimes you got to know when to fold them. When you win, you fold them, and you got to know when to go. So, any final takeaways from health that you'd like to share?
I love your term beehive, because that is what it felt like. It was buzzing with energy, and I think the listeners here are in healthcare, so perhaps we perhaps we're the worst audience for this, in that we want to be surprised. We want to believe that we can make change, that we can bring this to the next level. And I think if I were describing health to people that weren't there, then I would tell them, like, there's things happening. There's real excitement around what innovations are out there. And I know, as somebody who's worked in healthcare for a really long time, but also as a consumer and aging consumer, I'm excited. And that's probably the biggest takeaway I bring from it.
Well, I share all of that. And, as someone who's in the age group I'm in, it really encourages you about our future. When I looked around that exhibit hall, and I'm surrounded by millennials. I'm surrounded by young people who are just putting it all on the line and building companies. It makes you very optimistic about all of our futures. Well, thank you, everybody, for listening on the show today. You can learn more about the show on the programs page on healthcarenowradio.com, and lend your voice to the conversation on Twitter at HCNowRadio. Be sure to follow us on Twitter at SonarMD. We're bringing patients, providers, and payers together to reimagine GI care. Until next time, I'm Dr. K. Stay well.